Let's talk about how to volumize your face and address signs of aging without looking fake or overdone. This video will discuss biostimulatory fillers, meaning injections that stimulate your own body's production of collagen for rejuvenation and restoration of volume loss. My name is Dr. Swati Cannon, and I am a cosmetic board-certified dermatologist out here in California. This is part 3 of my filler series, where we're going to talk about 2 biostimulatory fillers called Sculptra and Radiesse. These fillers are used for tightening as well as for rejuvenation and volumization of the face. So I really want you to stay tuned till the end of this video so you can learn all about biostimulatory fillers. So like I said, there are 2 main types of biostimulatory fillers. You have your calcium hydroxyapatite, also called Radiesse, and polylactic acid, PLLA, also called Sculptra. There's a less common biostimulatory filler called Bellafill. This is actually made from bovine or cow collagen. I don't personally use this in my office, so I'm not going to talk about it. And then a 4th type of biostimulatory filler called platelet-rich fibrin or easy gel. And this one I have mentioned in my previous video, so go check it out. Radiesse is a calcium hydroxyapatite based filler. We're going to abbreviate calcium hydroxyapatite to CaHa because it's much shorter. So Radiesse basically consists of the CaHa microsphere suspended in a gel. When we inject this gel with the CaHa microspheres, you get immediate volume correction as well as delayed collagen regeneration. So scientifically, Radiesse works in 2 ways. When injected, the CaHa microspheres provide a scaffolding, and this scaffold helps to volumize the wrinkles or folds or any area that we inject it into. Over time, that gel is absorbed and the CaHa microspheres kind of degrade, and that scaffolding is replaced by your own body's collagen. So this process helps to extend the period of correction. So you have initial volumization followed by delayed collagen production, and the 2 together make Radiesse a pretty powerful combination, as it's the only filler that volumizes and has biostimulatory properties. So we call Radiesse a semi-permanent filler because of its collagen production properties. In the face, Radiesse is used for moderate to severe wrinkles like really deep nasolabial folds, severe volume loss of your cheeks or jawline. I personally like to use it in men to help create a more angular jawline or more angular cheeks. In women, I only use Radiesse if the skin is incredibly sagging and I need both volumization and collagen correction. But in women, I tend to most of the time use hyaluronic acid fillers to recreate the jawline or cheeks because it creates a softer look, which is much more feminine. The one downside of Radiesse is that it's not technically dissolvable, and there's a risk of vascular occlusion with Radiesse, just like there is a risk with hyaluronic acid fillers. But because there's not an enzyme that dissolves the calcium microspheres, it makes it hard to reverse any potential issues, including either vascular occlusion or simply that the patient doesn't like the filled result. There are reports of using a compound called sodium thiosulfate, which we use in patients who have calcium disorders to dissolve the calcium. So there are reports of using this to dissolve Radiesse, but this is not like a surefire treatment. So let's say Radiesse is done and you don't like the treatment result. Well, you have to wait a while for the calcium to dissolve and for the collagen to generate. I also don't like Radiesse for thinner skinned patients because it's a much more dense substance. So patients really need to have thick skin for us to be able to use Radiesse. We also don't inject Radiesse around the eyes or around the mouth because these are sphincter muscles, which can then contribute to nodule formation. A nodule formation happens in Radiesse when the calcium microspheres, they kind of aggregate together and they don't dissolve. This is hard to then treat. We can take simple measures, but usually we just have to wait for these nodules to dissolve. So we don't like to inject it around the eyes or around the mouth. Have you tried Radiesse fillers or really any of the biostimulatory or hyaluronic acid fillers? If so, let me know which one you tried and what your experience was with those fillers. If you haven't tried but you have questions about it, please also let me know in the comments below. And don't forget to hit the subscribe button so you can stay up to date with the latest and greatest in cosmetics and skincare. In my office, the most common way I use Radiesse is by diluting it. So I use hyperdilute Radiesse, which is when we dilute the concentration of Radiesse and use it only for its skin tightening or collagen production results. So I inject hyperdilute Radiesse into areas like the neck, the chest, the hands, flabby skin of the arms or knees, this low concentration of Radiesse doesn't really volumize the area, but over time it helps to stimulate collagen and elastin production to help tighten these areas. Hyperdilute Radiesse can also be used to tighten certain parts of the face, but I tend to use more Sculptra or PRF for the face just because it's more controllable. In areas like the chest or neck, where I am using Hyperdilute Radiesse for its collagen production properties, I will actually combine Radiesse sometimes with platelet-rich fibrin or PRF for like a dual collagen boost. The combination has been giving really great results. So here in this video, I am injecting the PRF and Radiesse combination into the décolleté, which is a common area where skin laxity can present as little chest wrinkles, and patients do not like it, especially when they wear the V-necks. So the combination of Radiesse and PRF is incredibly helpful to help get rid of these wrinkles. So how many treatments are needed for hyperdilute Radiesse? For neck, chest, and knees, I recommend a series of 2 or 3 treatments that are spaced 4 to 6 weeks apart. The reason we need a series of treatments when it comes to tightening procedures is because we're using such low concentrations of Radiesse that we need to be able to build upon the scaffolding and the collagen production. For flabby arm skin here, that usually needs about 4 treatments of hyperdilute Radiesse spread 4 to 6 weeks apart. Often I will combine hyperdilute Radiesse with other tightening treatments. So for example, I might do what's called soft wave, which is a high intensity focused ultrasound treatment for the lower face and neck to help tighten. I might do soft wave of the underarms to help tighten. So I often will use hyperdilute Radiesse with PRF as well as other modalities to help with skin tightening. So in summary, the advantage of Radiesse is that it not only volumizes, but it also causes collagen and elastin production. So it's called a semi-permanent filler because of that delayed collagen production. Because of its collagen production, we use the hyperdilute forms of Radiesse to tighten. The disadvantage of Radiesse is that we cannot dissolve it. We can try with sodium thiosulfate, but it is hard to dissolve Radiesse. By the way, if you want to learn more about other tightening technologies, please comment below and let me know, and I will definitely make a video about it for you. So make sure you hit that subscribe button and stay tuned. The second common biostimulatory filler is polylactic acid, PLLA, also known as Sculptra. Sculptra is made by a company, Galderma, and Galderma is the same company that makes CeraVe as well as the hyaluronic acid products called Restylane. PLLA, or polylactic acid, is a biocompatible, biodegradable synthetic material that stimulates your own body's collagen and elastin production. PLLA is actually the same molecule or a similar molecule to what's found in dissolvable stitches. So when I do surgeries, for example, I usually have to put 2 layers of stitches. The stitches that's underneath the skin, which is holding all of the tension, is dissolvable. And PLLA is very similar to the material, which is a polymer that's found in dissolvable stitches. Once the PLLA is injected, it disintegrates over time, producing carbon dioxide and water. But as it dissolves, it also creates a scaffold for collagen and elastin production, which then subtly adds volume to injected areas. Sculptra is known for producing very natural results, and it causes natural volumization. So yes, I do have some hyaluronic acid fillers in my face, kind of in the deeper areas and in my chin, but I also have Sculptra into my nasolabial folds as well as my more superficial cheeks, just to help kind of tighten things up. Sculptra is also known for giving that Sculptra glow. So that means that as we're using that collagen production to volumize the face, that same collagen production is also improving the skin quality, kind of making your skin glow. There was actually a study in 2019 that showed improvement in pore size, skin radiance, skin smoothness, and an increase in skin elasticity and hydration even 12 months after the last treatment with Sculptra. So Sculptra, we call it a semi-permanent filler as well because the results are very long lasting and the collagen that you make is yours. And yes, you lose a percentage over time, but the collagen you make is yours. Sculptra was actually originally used to treat cases of HIV lipodystrophy. And this is a condition where HIV patients who were on certain medications, they lost a lot of their fat pads within their skin. And we mentioned the anatomy of fat pads in my previous filler video of hyaluronic acid. So we have these fat pads that give fullness to our cheeks. And patients with HIV lipodystrophy were losing this fullness to the point where they looked really gaunt. So Sculptra was used to inject these areas to help revolumize them in a more natural way. In fact, when I was in residency, that is how I first used Sculptra, was in a patient with HIV lipodystrophy. And Sculptra recently got FDA approved to also be used for fine lines and wrinkles, especially on the cheeks. Until about 2021, it was incredibly annoying to use Sculptra because you had to reconstitute and dilute Sculptra for about 24 to 48 hours prior to injection. So you couldn't inject the patient right away. But in 2021, they solved this problem, and now we can constitute and dilute the product for about 30 minutes prior to injection. And we also have a slightly lower dilution, which makes injecting the product a lot more easy. So initially, before 2021, even when we were injecting Sculptra, the needles would get clogged upon injection. It was just kind of annoying. But now with this newer dilution method, it is a lot easier to inject Sculptra, and it has gained in popularity. So while Sculptra is great for facial volumization, it is also really great for body augmentation. So for example, I will use Sculptra in certain dilutions to augment the buttocks, so like a butt lift, a non-surgical butt lift. I will use Sculptra to help with cellulite. I basically subsize the cellulite, meaning I kind of untether the cellulite and then inject Sculptra to help fill the dimples and improve skin laxity. So Sculptra can be used not only on the face, but off-label it can be used on the body, just like Radiesse. By the way, cellulite is an incredibly common problem. I feel like I have a lot of by the ways in these videos, but in my office, I actually do a treatment for cellulite that is incredibly effective. So if you want to learn more, comment cellulite treatments in the comment section and let me know so I can make a video about it. And just like I do with Radiesse, I will even combine Sculptra with PRF or platelet-rich fibrin for face for that greater collagen boost. And I actually love the combination of Sculptra and Easy Gel. I think that combination is much more effective in the fact that the results are sooner. So I'm seeing volumization sooner and collagen production sooner than with a Sculptra or just, Easy Gel by itself. Now, no studies have been done, comparing Sculptra to Easy Gel or Sculptra plus Easy Gel. So these are all of my anecdotal experiences. And Easy Gel, which I discussed in this video before, it is a relatively newer modality of filler treatment. And so we're just now learning about it and using it in our offices. So we'll know more as time continues. When I use Sculptra on the face, I inject it into the cheeks, into the temples, jawline, even in the area called preauricular space here, which often becomes hollow if we are very active. I will use it for the marionette lines and to create a sharper jawline in younger patients. We don't inject Sculptra around the eyes, around the mouth, or in the neck. And similarly to what I talked about with Radiesse, these muscles around the eyes and around the mouth and the neck, they are sphincter muscles, meaning that they constrict upon activation. And when we constrict Sculptra, it can lead to accumulation of the product, resulting in collagen nodules. So this was, 10 years ago, 15 years ago, when people were using Sculptra in these areas. That's how they found out that they were getting all of these nodules. So over time, the practice of medicine has changed, right? Because we learn from our previous experiences. So we no longer use Sculptra around the eyes, around the mouth and neck. And that is why hyperdilute Radiesse plus PRF is a really great combination for the neck. That is also why I use PRF or platelet-rich fibrin on the eyes, or tear troughs and platelet-rich fibrin as a biostimulatory filler around the lips, because we cannot use Radiesse or Sculptra there. The nice thing about PRF, like I said in my previous videos, is that there is no risk of nodule formation, and that's why we can use it around the sphincter muscles. We can also use Sculptra or dilute Sculptra for acne scars or other types of atrophic scars. Atrophic scars means that the scar is indented in. And so often we want to, do lasers to plop these scars back up. But in addition to the lasers, we'll also use dilute Sculptra to help create new collagen in the area. Have you tried Sculptra? Let me know, and make sure you hit that subscribe button so you can stay tuned for more upcoming videos on the latest and greatest in cosmetics and skincare trends. Now, how many treatments are needed for Sculptra? So when we're talking about just facial volumization with Sculptra, usually patients will need about 2 or 3 treatments spaced 4 to 6 weeks apart. And because we continue losing collagen, an average of about 1% a year, and I think I mentioned this before, yes, we say 1% a year, but I don't think that we lose collagen or that we age in a linear fashion. We probably age in spurts, meaning that if you had a health crisis or a life event that was very stressful, you might age a lot in that 1 year, but you're going to be stagnant for the next few years, let's say. But on average, this amounts to about 1 to 2% of collagen loss a year. And so most patients will need one treatment with Sculptra about once a year for maintenance. For body augmentation, like a non-surgical butt lift, you're going to need Sculptra a lot more. Because for body augmentation, like the butt lift, it's also a series of treatments, usually about 3 to 4 Sculptra treatments spaced 4 to 6 weeks apart. After injection of Sculptra in the face, you do have a little bit of swollen face, and that's because we dilute Sculptra with water. So we're really injecting a very liquefied filler. And that's why there's also less risk of a vascular occlusion because the Sculptra filler is so kind of liquidy. So it's less likely to occlude compared to a gel. But initially, you have swelling because there's water where the Sculptra was injected. In 48 to 72 hours, that water gets absorbed, leaving just the PLLA crystals in the area. And those PLLA crystals get broken down, causing collagen regeneration. But you have swelling for 48 to 72 hours, which then goes away. So what I tell patients is, after we inject Sculptra, you're going to really like how it looks because things are filled, but then in 3 days, it's gonna look like nothing happened. So you really have to be patient and wait for the results. So collagen formation usually starts a few months after the second or third treatment, and I don't see maximal results until 6 months out. So it takes a good amount of time to see results, but the good news is that even 1 or 2 years out, studies have shown that patients still have collagen formation even that many years out after Sculptra injection. So in summary, the main advantage of Sculptra is that it creates a nice skin glow called Sculptra Glow because it helps to refine your pore size and it helps to have both superficial and deep collagen production. So it volumizes naturally over time. Sculptra also has a decreased risk of vascular occlusion because it's a more watery consistency. The disadvantage is that the results are incredibly delayed and that Sculptra is a more expensive biostimulatory filler than Radiesse or something like PRF. For many of my patients, I will use a combination of fillers to get the result that I want. So I will use hyaluronic acid fillers to fill those deep compartments. I will use Sculptra or Radiesse for tightening, followed by PRF to help fill those tear troughs or lips. So it's really a combination of these treatments that yield the best outcomes for patients. Each filler really has unique properties that we want to utilize with facial volumization. So be sure to like, share, and subscribe if you found my content helpful. If you have any questions or topics that you want me to cover in the future, please comment below and let me know. If you want to learn more about hyaluronic acid fillers or the natural biostimulatory filler called PRF that I've been talking about, then you have to watch these 2 videos to understand what fillers can do comprehensively. Thank you for watching, and remember, your face is an investment, not an expense.